Hello, everyone, and welcome to today's workshop. The Truth About Liver Cancer is produced by Blue Faery, the Adrian Wilson Liver Cancer Association. A nonprofit organization, Blue Faery's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, also known as HCC, through research, education, and advocacy. My name is Andrea Wilson Woods, and I'm the president and founder of Blue Faery. I started Blue Faery in memory of my sister, Adrian. I raised Adrian from the time she was 8 until she died from stage 4 HCC at the age of 15. So this is very, very personal for me. And I'm very excited about this topic today. Today's topic focuses on the emotional, practical, and relational challenges families face when someone is diagnosed with hepatocellular carcinoma, again known as HCC. You're going to hear real life perspectives from two families, and we are so grateful for them for participating. We're going to hear from a mother diagnosed with HCC along with her adult daughter. We're going to hear from a father and mother whose son was diagnosed with HCC. And through their stories, you're going to gain insight into caregiving, communication, coping, and family resilience. It really, really is a family experience when your loved one is diagnosed with cancer. Now, if you or a loved one is facing HCC right now, we encourage you to join Blue Faery's community. My co-host, Aura Sanchez, whom you will meet shortly, is going to throw in the chat right now a link to the Blue Faery's community. So again, please, we encourage you to check it out. Not right now, stick around for the webinar, but check it out. And it's a HIPAA compliant forum, so your health information is completely safe. Now, before I bring our first panelist to the stage, I want to talk a little bit about Zoom webinars. Thank you so much, Aura. I just saw that. So Zoom webinars is a little different than your average Zoom meeting. It's much more interactive. If you can't see a toolbar right now at the bottom of your screen, just take your mouse or your finger, if you're on a tablet, and glide it over the screen, and then the toolbar will pop up. And you're going to see a couple of different things here. First, you're going to see the chat, and you can chat with the host and panelist at any time. So right now, I would love for you in the chat to just let us know the temperature of where you are today. I'm happy to say it's finally getting warmer where I live in Birmingham, Alabama. So just let us know that you can participate in the chat. So you'll see the chat. Next to the chat, you should see a heart, and that's the reaction button. Ooh, 80 degrees. Wow. That's really warm. Reaction button, if you tap on the reaction button, you can give us lots of reactions. For example, you can give us a heart, or you can give us a surprise face. So show me that you can react. And I really encourage you throughout the webinar to react, right? So we can see people. Now, next to that, you're going to see the raise hand. We don't want you to raise your hand. What we want you to do instead, when you have questions, is to put it in the Q&A. Don't put your questions in the chat. So again, over to the right, you should see a Q&A. And again, you might have to glide your mouse or your finger over the screen because that toolbar just disappears. And that's where we want you to put your questions. At the top of the hour, we're going to answer all your questions, and all the panelists will be coming back to the stage. We're super excited about that. So can someone throw me a test? Ooh, 81 degrees. Oh my goodness. Can someone throw me a test question right now in the Q&A as practice? I see a lot of people coming in. Welcome. And again, we're going to answer your questions at the top of the hour. And if there's any more questions, let's see. Good. Also, you can enable captions. So if you click show captions, we will be sure that captions are enabled. And my name again, since someone just asked in the chat, is Andrea Wilson Woods. Hopefully that is showing up on your screen. All right. Oh, it's chilly where you're from. I just saw 39 to 45. Okay, great. Welcome. All right. So now that we all know Zoom webinars, don't forget you can chat with the host and panelist at any time. give our panelists lots of reactions so they know they're making a difference, that you like what you're hearing. And if you have a question for them, put it in the Q&A, not in the chat, and we will answer your questions at the top of the hour. Now, I'm really excited to bring our first panelist to the stage. So, Nicole, please join us. Nicole Wright-Derks is a volunteer with Blue Faery and a healthcare professional with over 17 years of experience. She brings both clinical expertise and a deeply personal perspective as a caregiver and daughter to a mother living with hepatocellular carcinoma. Nicole's advocacy is rooted in compassion, resilience, and firsthand understanding of the emotional and practical challenges families face in healthcare. A devoted wife and proud horse and dog mom, she connects authentically with audiences through empathy, lived experience, and a strong commitment to supporting patients, caregivers, and their communities. And I mentioned Blue Faery's liver cancer community. Well, guess what? Nicole is one of our community ambassadors. So if you join Blue Faery's liver cancer community, you will be interacting with Nicole quite a bit. Nicole, thank you so much for joining us on a Saturday.
Thank you. Thanks for having me.
So, can you take us back to when your mom was first diagnosed with HCC? And what was that moment like for you?
So she was diagnosed March 1st of 2019. Um, it was heartbreaking. It was the worst day of my life, literally, to have to be told that your only parent has hepatic cellular carcinoma, which at the time we were like, what is that? And what is going on? And what are we going to do from here?
My goodness. Um, what was the tumor like? I mean, was it small? Was it large? I mean, what were her options?
So it was a 7.5 centimeter mass, which is the size of a grapefruit. And they told us that basically we would do palliative care, but there was going to probably be no cure because her tumor was so big that we would never make it to receive a transplant from a deceased donor.
Oh my goodness. And just so people know, for most HCC patients, a transplant is your best curative option.
Mhm.
Um, can you tell us a little bit about your relationship with your mom and how the diagnosis affected you personally? And your mom, just for the people watching us live or watching us on YouTube later, her mom's coming up next, so we get to meet Nicole's mom here shortly.
Yeah, so my mom's my only parent and my best friend. I lost my dad when I was 15, also to a liver disease, cirrhosis of the liver. So it was definitely a strike to the heart when she received her diagnosis. I'm like, how can I lose one parent with liver problems and then have another parent who never drank, never did drugs, nothing of those sorts, and get this horrible diagnosis in her liver?
I'm so sorry to hear that. I did not know about your dad. Um, after her diagnosis, how did your role within the family change? Like how did the dynamic change?
Well, working in healthcare, you learn how to be an advocate for yourself, which I would tell anyone that they have to advocate for themselves with any type of cancer diagnosis for sure, but especially with HCC. I started reaching out and reading medical journals and finding out information and different treatment options, which is also what led me to find Blue Fairy.
So, um, we're grateful for that, by the way. I'm really glad you found Blue Fairy early.
Me too.
And we are going to meet in person soon, but I've had the pleasure of meeting your mom. Um, Everyone copes differently with illness. So how would you describe the way you and your mom handled the journey together? And we'll ask her point of view of this as well.
I would say that we're really a strong team together. She also worked in healthcare, so she also knows how to advocate for herself. And then, of course, myself being in healthcare, advocating for her as well. I wouldn't say the dynamics changed really. It just we were already so close, but we became a closer team. We were fighting for the same reason to get to the same outcome, which was to ultimately become cancer free.
Okay. And Your mom's going to tell us more about the treatments themselves, but as the treatments continued over time, I mean, what was it like for you watching your mom go through this process?
Yeah, so she had 7 different treatments, which was all palliative care that was supposed to shrink the tumor and give her more time. Um, each treatment was a whirlwind of about a week being down. So I definitely stepped into the caregiver role to take care of her, make sure she was okay. But she's really a warrior and she bounces back quite nicely. Um, so yeah, I would say that it's just working together as a family. I can't say enough about having people in your life to support you during this journey.
You mentioned palliative care, and I don't think we've defined that. And for people watching, by the way, when these terms come up as much as possible, we'll put them in the chat. But we also have a glossary on Blue Fairy's website where you can find most of these terms. Will you tell, as a healthcare professional yourself, will you tell the audience what palliative care means? Because I feel like people confuse palliative care with hospice.
Yeah, absolutely. So palliative care is basically different treatment options that can give you, it's not a cure. You will never be cured with palliative care, but it is to give different treatment options to give a better quality of life and hopefully a longer, a more longer lifespan. So it can be, in our particular case, just different treatment options like the taste that we had and different things like that. I'll let her go into that more. But yeah, it's just getting different treatments to keep the patient comfortable and to hopefully prolong the inevitable.
Okay. I really appreciate you defining that for us because I think it's a really important issue. And I think a lot of HCC patients with advanced disease don't understand that the treatments they're getting are palliative. And I think
Mhm.
if more people knew that, it might change their decision-making process, right?
Mhm.
Um, you mentioned transplant earlier, um, and I know things changed. How did your mom, when did she become eligible for transplant, which is kind of the ultimate goal? Like after how many years of treatment and what was that like?
Oh my goodness. So we had 5 years of treatment. Let's see, 19, 20, 21, 22, 5 years of treatment. And then she had the Y90 procedure, which is what led us to get on the transplant list. They said that we would never make it there. We were never going to be a candidate for transplant. And lo and behold, the Y90, which I call our magical procedure and treatment that we had, led us to transplant. It kept everything. Basically stable. Nothing was growing. So that's what led us to the transplant. And she was transplanted with her new liver April 20th of 2023, which was a
Wow.
miracle.
Wow. Okay. That really is a miracle. I didn't realize it was that many years of palliative treatment. Like
Mhm.
I think you just gave a whole lot of people, I know you just gave a lot of people hope. Um, what was it like? What was the follow-up like after transplant? Because I think that's another piece of the picture, and that people transplant's the ultimate goal, right? It's
Right.
curative, but then there's a lot that happens after transplant.
Yeah, so she received her new liver from her deceased donor, like I said, April 20th of 2023. She was in the hospital. They called her the VIP transplant patient because she's such a warrior and she had absolutely no complications. She made it look like a breeze. Like no nothing really phased her while she was doing that. So we were very blessed in that aspect. But yeah, it changes your whole life. It changes your eating habits. It changes your medications and your daily medications. It was a brand new start. We thought that we were cured and we thought that we were on our way to, her getting to live out her life the way that she wanted to and being cancer free.
Okay. And since you were the person searching for options, what challenges did you encounter when you were trying to find the treatments or clinical trials after transplant?
A lot of roadblocks. So I guess we probably need to say so a year later after she received her transplant, HCC did reoccur. They said there was less than a 10% chance that it would ever come back and that we were cured. And for the next almost full year, we thought we were cured. Every scan showed no signs of HCC. And then in March of 2024, I believe that's correct, it showed up in her lungs. And that's when I started reaching out. I'm like, what kind of treatments are out there with someone who has someone else's organ? Because it makes the body extremely tricky because we don't want the body to reject that foreign body that we have in there because we've tricked it to make our bodies believe that it's our organ.
Right. That's a very good way of putting it. And I'm glad that you brought up it is a very small percentage of people after transplant for HCC to recur. And it does then sort of limit your treatment options, like you said, because you don't want your body to reject the healthy liver that you got, but now the cancer is back. Um, did you look at clinical trials? Was that something that you started diving into since you were the one doing all the research?
We did, and unfortunately, every clinical trial that's out there excludes transplant patients. We
Mm,
finally got an appointment with the Mayo Clinic, and we went up to the Mayo, and we did learn that they have done immunotherapy in people who have had liver transplants. It's a very small number, only about 20 to 25 people in the whole United States who have
wow.
done this immunotherapy. And again, it's very risky because you've got a perfectly good liver, but you could walk in and do immunotherapy and you could have acute rejection, meaning that the body will reject that liver and there is no way to bounce back from that rejection.
Talking to you now and having talked to you on other occasions, um, you seem like you're so strong for your mom. What was this like for you personally? Because I know for me as a caregiver for my sister, um, I I was on the outside very strong for her, but I didn't feel that way on the inside. So if you don't mind sharing, what was it like for you on the inside?
The hardest thing that I've ever had to go through, and I'm still going through. We're still praying and hoping that we're going to receive a miracle drug is going to come out and FDA is going to approve it, and she's going to be one of the ones to be able to get that. It's an emotional roller coaster. There are good days and there's really bad days and really dark days.
Yeah. I'm tearing up just thinking about it. So, um, how did your mom's HCC diagnosis influence decisions that you've made in your life?
Um, mm, I guess just trying, I mean, it hasn't really changed things. It's just I want to advocate for liver patients and for HCC patients. I think that there is a lot missing information, and I think it's really important that we get it out there and that we help as many people as we can that's diagnosed with, this is considered still a rare cancer.
Right.
So it's important to get all of the information we can into people's hands and make them understand, what exactly they are facing and what they're dealing with.
I'm really glad you mentioned that because it is a rare cancer in the US, but it is not worldwide, right? It's a
Right.
very common cancer worldwide. It's the fifth or sixth most common cancer worldwide, and it's the third most common cause of cancer deaths worldwide is HCC. So I think that's one of the challenges we face because in the US it is considered a rare cancer. It doesn't get the attention it deserves, but it really isn't rare. Um, when you feel overwhelmed, if you ever do, um, what do you do to process your emotions?
So as in my bio, as you said, I do have horses. So the barn is it's my serenity and my peace. It's where I go to just let myself fly, really, and to just be
Mhm.
free with my thoughts and try to process things out in nature. I mean, that's one thing I can't stress enough to caregivers as well, is that you have to find an outlet to be able to be the best you can be for yourself, to be the best you can be for your loved one.
I love that. I think that's really important. I don't think I personally did enough of that when I was a caregiver for my sister. Last question, and then Nicole will be back at the top of the hour for the Q&A. What message would you want other sons or daughters supporting a parent with HCC to hear?
Yeah, I mean, this is the circle of life. We have to be there for, they brought us into the world, and, it's now our time to, help them shine and take care of them. It's just completely the circle of life. Don't underestimate any days that you have. If you have an extra 5 minutes, pick up the phone, call your mom or dad, tell them, that you're just thinking of them and that you love them, or go and spend the afternoon with them, even if it's just a few hours. It's just time cannot be replaced.
Oh my gosh, that is so well said. Yeah, it's the one thing we none of us get back, right? Is time.
Right.
Well, Nicole, thank you so much. I can't
Thank
tell you
you.
how I've already been tearing up, and we have three more
Me
panelists to
too.
go. So, Nicole is going to say bye for now, but she will join us again at the top of the hour for the Q&A. So, if you have questions, please put them in the Q&A now. And next, we're going to bring Aura up. Aura and I are taking turns today as co-host. Aura Sanchez is Blue Fairy's program manager. She is native Colombian and she is incredible. We are so lucky to have her. So, Aura, I'm going to pass the baton over to you to bring on our next panelist.
Thanks, Andrea. And thank you, Nicole. We're going to be bringing to the stage Vicky Wright. So, Vicky, whenever you can, please turn on your camera and come join us on stage. Vicky Wright's journey began in March 2019 when she started her work shift feeling unwell and ultimately found herself in the emergency room as a patient the following morning. Later that afternoon, after scans and testings, she was diagnosed with hepatocellular carcinoma, HCC. Because her original tumor was too large to be surgically removed, she underwent several targeted therapy procedures to shrink the tumors. She eventually qualified for and received a liver transplant on April 20th, 2023. She did well following the transplant until March 2024 when she was diagnosed with metastatic HCC, in her lungs. Hi, Vicky. Thank you for joining us today.
Hello, how are you? Thank you for having me.
We're so excited to have you. So I want to start off with our first question. Before the HCC diagnosis, what did life look like for you and your family? What was your day-to-day like?
Well, life was pretty good. I worked full time in an emergency room trauma center, and I'd actually planned on working until I was about 70 years old. I enjoyed my job, um, did things with friends, and family, and just pretty routine stuff.
Awesome. And when you were diagnosed with HCC, was this you worked at an ER? Was this the first time you ever heard of HCC?
Yes.
Wow, wow. And when you first realized, I know that you said that you were feeling unwell. What were those symptoms exactly? What did you feel?
That night or that afternoon, I worked overnight, so I was getting ready for work and just felt, I don't know, kind of a cross between nauseous and just not having the energy that I usually had. But I went ahead and went to work because sometimes you don't feel so great. You get to work, you get busy, and you forget, it just kind of goes away, resolves
Right.
itself, and life's
Yeah.
good. It didn't happen that night. I just kept feeling worse, and a couple of the ER doctors were like, "You don't look good. I think you need to check in." Well, I didn't have any relief, so I had to wait till I got off work that next morning, and then things just kind of snowballed from there.
When you first received that diagnosis, were you on your own? Was Nicole with you?
I think actually the nurse that was taking care of me while I was in the ER, if I remember right, I think she called Nicole because she knew Nicole. Nicole worked there also. So she reached out to Nicole. I don't know if I'd had my diagnosis yet or if it was in the hospital room. I can't exactly remember.
Gotcha. And well, when you eventually did get your diagnosis, what was that like for you?
It was shock, disbelief. Uh, it's like, what now? What do we do now? So it's just
Did
a lot
the
of different things.
Right, and did the doctors offer any options? What were your next steps after that?
They did. The hospitalist consulted the oncology department, and one of the oncologists, um, he really got the ball rolling. He had a connection. He was an oncologist there at the hospital I worked at, but also with a teaching hospital. And
Right.
so he was like, Doctor, I know Dr. Kumar. He maybe we could resect it because they didn't realize quite the size of it and all that. While he was in my hospital room sitting on my bed, he called this surgeon at the teaching hospital. They talked, we talked. I got an appointment right away. I mean, it's kind of like being in the right place at the right time. Things just kind of happen in a very good sequence for me.
Right. And can you take us kind of the treatment journey? What treatments were you able to get, and how did you, I mean, I know Nicole talked a little bit about it. How did you ultimately get to transplant?
Um, when I went to the the teaching hospital and I met with the surgeon, and when they realized they could not resect it, he told us about interventional radiology. And so I met with that doctor. That I had three taste treatments, which is where it's kind of like having a heart cath, and they uh, inject thousands of micro um, chemo beads directly into the tumor, hoping to cut off the blood supply and shrink the tumor. I had the first one, and then you wait 3 months, get scanned. So more tumors were showing up. So then I was scheduled, I believe it was a microwave ablation. And that they try to more or less, for lack of a better term, burn that blood supply
Right.
to cut off and kill the tumor. Went back 3 months later, still more tumor. So then I had a TACE, and it was kind of in that sequence: a TACE, microwave, TACE, microwave, TACE, I believe. And then um, my hepatologist, we looked at all that, and I was just not getting any results, still getting tumors. And he said, I just don't think we're going to make it to transplant. And then there was one more option, the Y90. And I kind of felt like they didn't want to put me through that. And I'm like, no, I think I want to try it. It's the last thing. We haven't tried this. So we
Right.
did. Um, I had to be tumor free 6 months. So at that appointment where it was about 6 months, Dr. Olson had suggested, let's try uh, putting you through transplant evaluation. I think we could do this. And so that's what happened. And I qualified for
Wow.
transplant. So um, did I answer all your
That's amazing. Yes, yes, you did a perfect job at answering my questions. And so while you're going through these treatments and trying to get on the transplant list, what was that like for you emotionally? You seem like a very strong lady.
It it was just a roller coaster, like I said, but the biggest way I got through it that worked for me is that I just believed, you know, the Lord knows when our so-called expiration date is. None of us know that. And I just felt like if I concentrated on worrying about it, having a lot of anxiety about it, it wasn't going to serve any good purpose. And so I just tried not to really focus on that. And I didn't want my cancer to define who I was and what I did. So that's kind of how I got through all that.
Yeah, yeah, I definitely agree with you. And so when you finally got that call that you were eligible for a transplant, what was that like?
Oh my gosh. I got two calls. The first one, I was with a friend and we were shopping. I get this phone call and like, oh my gosh. And my husband was out of town. He was on a disaster in I think it was New Orleans when they had all that flooding and stuff. So he was gone. I called Nicole, and after I talked to the staff more, that liver was questionable. The donor, it was a risky liver. The donor could have, and the way the doctor said it, it's kind of like he was telling you that they can't. He said there's a strong possibility
Right.
the donor may have had multiple sexual partners. The donor was an IV drug user. The donor probably did heroin. The donor probably spent some time in prison. And the donor probably had same sex uh, sexual partners. And thinking of all, you just don't know what to do because you've got to make that decision fairly quickly. And
Right.
I don't know, I just decided after talking to Nicole and we had a three-way conversation with the surgeon. I don't know, it just didn't sit right. And I felt like, I don't know if I want to risk taking on something else that I don't have. So I declined that. And then about 6 or 8 months later, I got another phone call with a great liver. And
That's amazing.
everybody was in town, so it it worked out well.
Wow, yeah, that's amazing. And what did you do to prep yourself for this transplant? And what was everything like after you finally received that transplant?
Prep, you know what, in your head, or at least in my head, I don't really have a whole lot of time to prep because when they call, when they called me for the second one, they wanted me to get down to the hospital in 2 hours. And so my mind is just, which is probably a good thing, rushing around getting my bag. I didn't have my bag fully prepared. And so getting, that stuff together. Then they called me and said, well, you don't rush, whatever it was, you've got a couple more hours. So I get down there and things kind of stalled for different reasons because the donor was not here in Missouri. The donor, I think Nebraska maybe, but and they can't really tell you that either. But you have so much going on. Labs, you have social worker, you have the residents and all these things. So and it's a good thing your mind's kept busy. And after the transplant, at some point, it's like, it's almost too good to be true. I can't believe that this happened. And I've been blessed with this gift. But mostly that's the thing. And how I was able to get back to my normal life after, a huge um, surgery like that.
Yeah, definitely. And so Nicole mentioned a little bit that the HCC came back. Um, can you walk us through that and what do you do every day to stay strong after receiving such news?
Um, yeah, I remember the day that I had to, it was like my 11th month follow up. And so my hepatologist wanted to order a CAT scan. He said, "What? Let's not wait for the year point. Let's just do it now." And I was, had the scan, and it came back metastatic disease. And I hadn't gotten any phone call from the doctor, so I called because in my head, I'm like, that can't be what I think it is. There's got to be a mistake or something else. So I got a hold of them. They called me back and confirmed that it was. So the next step was to have a bronchoscopy so that they could do a biopsy, and it definitely was confirmed. It's gut wrenching, heartbreaking, all those things, because you're reassured so strongly that there's a very small percent that there's recurrence. And then especially when it's not even a year out. But,
Yeah.
the same thing. Nothing's going to change it. So we have to move forward and see what there is to do.
Yeah. Thank you for being so positive. Now, I want to move to my last question. What message would you want other families facing HCC to take away from your experience?
I don't know. I feel like I've been very fortunate. I have strong family, my daughter, my husband, my sister, different extended family. I have a lot of friends from, different stages of my life that have, come forward and are always praying, doing things with me, the positive reinforcement that they give me. If you're lucky enough to have all that, that makes it easy. If you're not, I just think trying to maybe network with people that can, like Blue Fairy or some of the support groups, but it's hard, but try to reach out, because for a lot of people that's hard. They're not that type of personality. And you kind of have to force yourself and just try to stay I know that all sounds really easy and cliche, but it's just kind
Yeah.
of what worked for me.
Well, thank you so much, Vicky, for sharing your story with us and being here today. We will have Vicky come right back at the top of the hour, and now we're gonna bring in our next panelist. Thank you, Vicky. We'll see you in a little bit.
All right.
Thank you. Now we're going to bring to the stage Laura Monlux. Laura Monlux put herself through college working in a hippie boatyard. Her love for boats led to a management career in marine publishing and insurance. At the age of 40, she retired to raise her two children. More recently, she returned to the joy of working with her hands as a potter, finding clay to be a wonderful medium for coping with stress of caregiving. Hi, Laura, how are you?
Oh, God, thanks for inviting me.
Of course. So, Laura, I we want to get to know you a little bit. So, can you tell us a little bit and take us back to, um, I know you have your son Will, how he was first diagnosed, how all of this came about?
He's living with us. He moved down during COVID. He had managed a mental health outreach program and it had closed. He was also burnout mentally. He was working, he was applying, he was thinking about applying for medical school. He did his MCATs, he did great. He was doing very different jobs. He worked on the vaccine teams during COVID. So he was with us. And we were going, okay, is he moving out pretty soon or not? But our house, it works that there's plenty of space for people. And he was going, he'd go out to dinner with us every once in a while. And he typically would vomit up his food. And of course, we weren't. But he said, oh, it's just food poisoning. And about the third time of going out, typically he likes Thai food. My husband and I looked at each other and said, this is not food poisoning. And then in the December 3 years ago, he had extreme pain, and his pain tolerance is very high because he's had several neurosurgeries in the past. And he was in such pain. My husband took him to the ER, and our son thought it might be appendicitis. And the ER doc was very blunt, which was appreciative to my son, saying the tumor in his liver was the size of a brick.
Wow. Wow. And what was that like for you? Were you guys in the ER room when you heard this news as well?
Um, my husband, I believe, I don't quite remember, but I think he dropped him off at the ER, went back, and then it was all about what do we do next. So there was some talk of taking the tumor out. We decided the best option was to go to a major cancer institute over in Tampa. And it was a process of trying to figure out what to do next.
Right. And for you as a mother to hear that your son suddenly has this, what was that like for you?
Well, there was tremendous sense of loss because you expect your child to do great things for the community and give back. And it was like his doors were closing. And that's not what a mother intends for her child.
Yeah, absolutely. It must be heartbreaking. And so when you were given that news, did your role change at all within the family structure?
My role has always been to keep everyone together. We have
Mhm.
fairly strong personalities. We have a daughter who lives within 3 or 4 hours away, and we have a son who lives in California. He's my stepson. But my job is always to keep the family together. So I moved back into my management role, saying, okay, every Sunday night, let's talk about the doctor's appointments, what to do next. And I think that calmed us down because there was so much involved in trying to figure out what was next.
Right. I can imagine there must be so many different things involved with with appointments and everything that comes with it. What unique challenges actually come with caring for an adult child that's facing liver cancer?
Um, well, he's not 10, and you can't send him to his room when he doesn't agree with you. And he is in charge of his medical care. Now, my son has a biochemistry degree. He immediately got into the world's research of looking at all the studies around the world because he was definitely going to have to go toward experimental. And then he would shuffle hundreds of papers over to my husband, who is a physician, and my husband would have to sort through them to see if there was any possibility. So I think from my role, it's hard not to want to be the mom who says you have to do something when I really had no control. And that is something I have continued to struggle with. The food, sometimes he wants to eat this, sometimes he doesn't want to eat that. Sometimes I have to throw out refrigerators worth of food because he just can't eat what he thought he could eat. We did the whole fresh juice for a while, making crazy concoctions. We don't do that anymore. He doesn't want that now. So I've been in a support role and I haven't been in charge. And that was very difficult for me.
I can imagine, like you said, he's not 10, you can't send him to his room anymore.
Yeah.
And throughout this, how did Will respond emotionally to his diagnosis?
He's been incredibly optimistic. At one point, the options with experimental medicine, it wasn't working anymore. And the doctor came into the hospital room and said, it's time to go into hospice. And Will was very diplomatic. Once again, it was his choice because that's our philosophy. And he said, no, I want to try this. So I want to get transferred to another hospital and have emergency surgery to stop a bleed that was going to kill him. And Tampa General, shout out to Tampa General, went to work on him and saved his life. And then his kidneys were failing, so then he went into dialysis. And we were very fortunate that people, medical personnel, really said, look, this guy's too young to die. We'll do what it takes.
Yeah. Wow. That's amazing that Tampa General was able to do all of that. And with the caregiver role and everything that you're doing, I know that sometimes caregiving can be overwhelming. Um, can you tell us what that has been like for you and what has helped you personally cope during the hard times?
Well, Will's been in the hospital a lot. I mean, 6 weeks at a time. I mean, he has been. So I pace myself when he's in the hospital. I don't go every day. I go every other day, every third day. And I always let him know when he's coming so he can count on that. And my objective and his objective is to get him out of the hospital bed and get him walking. And so he really looks forward to that when he's in the hospital for long periods of time. And I always take a break when I'm visiting him. And I go down to the Starbucks and bring him back hot chocolate. But it's a break for me too. So I'm really into pacing myself. That I didn't know it would be 3 years, but it's been a long-term process. So when he's home, I have exercise is critical for me. I walk the dogs. The dogs are an amazing support system, both to our son and to me. I also am a potter, and I started learning all about clay on the wheel and hand building about 4 years ago. So that, and it's a community of fellow potters that have been very supportive of me.
All right. Oh, that's amazing. Yeah, I heard that you're very into pottery. That's great that you have an outlet that can help you cope. And so now I want to go back a little bit. I know that many families struggle when their loved ones make treatment decisions that they might not agree with. How do you navigate that with Will?
Well, it's a discussion. Clearly, especially we're blessed to have his dad as a doctor, but it's always ultimately his decision. And that's my philosophy in life. It's, we are in charge of ourselves. And so if he wants to train for a marathon, we will support him training for a marathon. And he ran 1 year, almost to the date after he was advised to go into hospice, he ran a half marathon. And then wow. Last August, he ran a full marathon. I mean, we support him in how we can all the time.
Wow, that's amazing. I must be so proud. And now I just want to go to my last question. And I want to know, what message would you want other parents whose child has HCC to hear?
Take care of yourself first. Because if you're not able to take care of yourself first, you really cannot give what those children need. And pace yourself. I think this is a long haul, for some longer than others, and it's exhausting. And the last thing we need for the caregiver to do is to get ill.
Right. Thank you so much, Laura, for your time today. We're going to have Laura come right back at the top of the hour for our Q&A. Now I'm going to pass the baton back to Andrea, who is going to speak to our last panelist.
Thank you so much, Aura, and thank you, Laura. I'm really pleased to bring Laura's husband, Dr. George Monlux, to the stage. George is board certified in family medicine and a medical researcher for the last 8 years. He graduated from the University of Washington School of Medicine and completed a residency in physical medicine and rehabilitation at New England Medical Center, Boston. His medical career has included Army General Medical Officer, emergency medicine, family practice, PM&R, and research. He has been married to his wife, Laura, for 36 years, the same Laura we just met, and they have 3 children, Mike, Will, and Vera. Dr. Monlux's mother and father died of cancer, and Dr. Monlux himself is a cancer survivor. He's the father of Will, who has stage 4 hepatocellular carcinoma. George, thank you for joining us. Can we see you on camera? Great, fantastic, perfect. Thank you so much. So, we heard from Laura. Want to hear about you. So, can you take us back to when Will was first diagnosed, and especially from a physician's point of view, what was that like for you personally?
Well, the feeling was shocked that how can he be having this diagnosis at this age, young age?
And how old was he?
He was 28 at the time.
28. Wow. And as a physician, did you know a lot about HCC?
You know, I really didn't. I really had not come across it, and just really knew very little about it. But I very rapidly read everything I could and learned what I could about it.
Tell us about that. How did you rapidly learn everything you could?
Well, I mean, I went online, I looked to see what was going on. I went into AI. I looked, did what I could because, I didn't want to go try and look up a bunch of textbooks. I didn't have enough time. So I
Right.
just did the best I could to get as much information as I could.
As both a father and a physician, did having your medical background make this journey easier or harder?
Well, it does, in terms of and knowing the questions to ask and knowing how to overcome the barriers, I think that's helpful. But in terms, I can tell you one of the problems, it was a problem as a physician. I think I knew too much about what could go wrong. I think I got very resigned about having an awful outcome. So in my own mind, it was really totally devastating. And I think another big problem I had was I thought I knew what was best for him. So
Mm.
he's an adult, and that was the biggest problem in our relationship, coming to grips with the fact that, listen, he's the one in charge, not me, even though if I think I know best.
That's funny because your wife, Laura, mentioned that he wasn't a little boy and you couldn't send him to his room. Um, but Will was also, researching treatments and clinical trials. What was that like when he brought those to you? Tell us about that because it sounds to me very collaborative.
Well, I think it was transformative because I really didn't know about what was going on. I think I really had no idea that all that stuff was going on. And there was a lot of stuff out there that was available that even the doctors that were taking care of him didn't know about. So he was able to find stuff. It was kind of overwhelming because suddenly I'd shift to, I'm responsible for getting through this because he wasn't doing very well. He was having problems. And it was kind of like, well, now what can I personally do? So things shifted to, well, I got to do something.
I don't know if this was a question we asked you, but I have to ask, where not every patient does what Will did. And we heard from Laura that he had gone through medical school or started medical school. Um, it sounds like he had a very innate curiosity. Where did that come from?
That's a great question. I think he's had that since he was a kid. Um, so he's just, but he's been a kind of a silent guy that he takes action. He's a silent leader. He's a guy that you don't really know totally what he's thinking, which makes it tough. And then, but he's definitely in action. He has incredible courage. And the thing about him that really amazes me about, he takes this problem that was really difficult and tried to think, well, what can I do to help other people and myself?
And I should mention, just for everybody listening, and again, if you're watching the replay on YouTube, a year or two from now, whenever, I had the great fortune of meeting George because he talked about Will's journey on LinkedIn. And I was like, who is this man, George, and who is his son, Will? And I was so innately curious myself. So George, tell us, did there come a time in Will's journey where the medical team felt like there were no further options available?
Yes. And well, we knew that was coming, and Will, ahead of time, had looked around. We had looked at the clinical trials that were available, and we exhausted that. So he was able to identify somebody that, and her name was Dr. Vicky. He was able to identify somebody that, when I reached out, she was willing to come up with some options that were not normally available. You wouldn't think about it. So that was, I think that was really important in the background, knowing that when we got to the point where it looked like there was no hope, we still had hope because we knew that there was something possible. I think when you have no hope, it's just catastrophic and definitely devastating.
I agree. I think at Blue Faery, we really pride ourselves on giving support for patients and families, but also giving realistic hope. You always have to have hope. This physician he found, can you talk to us about how he was able to get that treatment? Because we were hoping to do a separate workshop on this topic completely.
Well, I'm going to invite people to actually attend that workshop because she's really expert in the area, but only about a tenth of, about 0.5% of people ever are able to access compassionate use. It's a very difficult pathway to take.
Yep. Yeah. So kind of or we'll put in the chat compassionate use. But compassionate use is essentially when you're able to get access to a drug without being formally in a clinical trial. And I went through something very similar with my sister. George, how did you feel, you personally, going through this with your son, Will?
Well, it's the hardest thing I've had to ever do. Unless you go through it, you can't really understand it. I mean, as a physician, I'm used to dealing with tough problems.
Yeah.
When it's your son, it's really different. And there's no words that can really explain it.
Right.
When it's somebody young, that makes it even worse because, you think about all the potential they have. It's very, very difficult. I mean, as a father, as a physician, you know all the things that can happen down the line. But one thing I will say that I have a whole different respect for people who are the caregivers and a lot more attention about how difficult it is. I mean, we can be strong, but I will tell you, when you go through this for a long period of time, it becomes like a black cloud over you all the time. And you have to have some strategy to do this, or else you're going to go into depression or pretty bad anxiety.
What strategies have you used to cope? I believe Laura talked about, pottery and timing her visits in the hospital to Will. What strategies have you used to personally cope? Because I think every caregiver needs to hear that.
Well, one thing that transformed everything was when we were able to um, learn more about compassionate care, right to treat. And then we were able to start, Will and I started working on how we could support that and help other people. And then we became much clearer about uh, how important that was. So I had a mission. I was focused on what I could do. I was able to have something I could do and not feel totally helpless. So, that was really, I think, very critical. And then the usual things that my wife cooked great meals for us. She was highly supportive. I exercised. I did all those things. Um, but I had a special strategy that I actually felt that I could do something, which is really difficult being in a situation where you feel that you can't do anything. There's no option. You're stuck.
And I want to let everybody know that we are going to have links to George's organization in the description on YouTube. And we also have that on Blue Fairy's resource page, the Wonderlink Foundation, where it does a deep dive into accessing clinical trials and compassionate use. Um, George, what's a really, well, Laura mentioned something about Will running a marathon or a half marathon. Um, and I know you had talked a little bit about this too. So what's a really powerful moment that you witnessed with Will, um, you know, during all this?
Well, yeah, it was actually a triathlon, which is not quite as long. And the first
That's
thing
harder. Are you kidding? I've done
was
marathons, man. I can't
well,
do a triathlon. That
well,
involves swimming.
I think what really was amazing to see him train for that, where I thought, there's no way you should do this. I mean,
Right.
again, my telling him there's no way you should do this, and he did it. Um, I he trained for it. It was when he came across that finish line, it was amazing.
I bet. I bet. I still remember the moment when my sister got, I had been training for a marathon when she was diagnosed, and I still remember the moment where she got on my treadmill and insisted on exercising because she was losing muscle mass. Now, meanwhile, she had no immune system. We won't go into it, but her ANC, absolute neutrophil count, was zero. She could not leave the house, and yet she insisted on exercising, because she didn't like she was losing all this muscle mass in her legs. So, there's something really powerful about someone with this disease who perseveres and doesn't give up. It's really powerful and it's making me tear up. So, what is a message of hope you would want other families facing HCC to hear?
Well, I think that they really hope is really key. You have to know the questions to ask. So that means you do have the right to ask for compassionate use. You want to be aware of clinical trials. And if it looks like you have been told that there's no option, it's wise to get a second opinion. I don't want anybody to have false hope. I mean, you need to go through and do this in an organized manner. Um, and that can be, you'll be talking later on about how people can access that.
Yes. So I just want to echo what George said before we go into our Q&A. We've got some great questions. Thank you so much, everyone. Um, Always get a second opinion. That is something Blue Fairy can assist with. That's why we really encourage you to join our community. Sometimes second, sometimes third opinions, and always look at clinical trials. Clinical trials, if you have advanced HCC or advanced cancer, I think of any kind really, but if especially advanced HCC, clinical trials should be a first option, not a last resort. I can't emphasize that enough. And on Blue Fairy's website, yeah, we have a clinical trials a tool that is custom for HCC. So it's pretty cool. All right, George is staying with us. we're going to bring all of our panelists back and my amazing co-host, Aura. So Laura, Vicky, Nicole, and Aura, please come back. And before we jump into the Q&A, Aura's going to launch a little quiz, and we want to see how the audience, how well you guys learned. And I've seen more people have come in since we started. So this is, according to today's speakers, why is having a support system important during your HCC journey? Now, unfortunately, we can't vote because we know the answer, but we're going to leave the quiz up for a few more minutes. Well, not a few more minutes, 1 more minute, guys. We're going to leave the quiz up. Hopefully, everybody can give us a thumbs up in the chat if you can see the quiz. Let us know that you can see it. I think people are afraid of the quiz. Don't be afraid of the quiz, guys. It's not
Don't be
scary, I
afraid of the
promise.
quiz, right? And
Yes,
if you already answered the quiz and still have questions, make sure to put them in the Q&A. This would be your a good
perfect
chance to
time.
do that. Yeah.
Yes. Okay, so I'm going to read oh, they can't see the quiz for some reason. Cannot see it. Oh, Lucy can see it. Okay. All right. Well, I'm going to read it. I'm going to read it, and then I'm going to have one of our panelists answer. So, according to the speakers, why is having a support system important during HCC journey? We apologize if you can't see the quiz. Zoom changes their settings, it feels like every other day. So we always try to check right beforehand, but it happens. So it reduces the need for medical treatment. It helps patients and families cope emotionally and navigate care. It replaces professional healthcare guidance and eliminates uncertainty during treatment. So any of our panelists, A, reduces the need for medical treatment. B, helps patients and families cope. C, replaces professional healthcare guidance. Or D, eliminates uncertainty during treatment. What do you guys think? A, B, C, or D? Anybody? Or why don't you give the audience the right answer? Ah, B, yes, thank you. In the chat,
All
B. There it is. Okay,
right. So
fans
the right answer is B. It helps
is
patients and families cope emotionally and navigate.
that's right. Okay, let's get to your questions, guys. These are so good. Let's see. First from Katie Evans. We touched on this a little bit, and it is in the chat. But since we're going to give this one to you, Victoria, because I want you to describe it from not a medical perspective, but a patient perspective. What is Y90?
Okay, Y90 is an interventional radiology procedure. It's kind of it's like the taste that I talked about. They go up through your groin, kind of like a heart cath. And instead of the chemo beads, they use radioactive beads. Tens of thousands of radioactive beads are inserted directly into the tumor. And again, hoping to reduce the size of the tumor and cut off the blood supply to that tumor.
Thank you so much. Okay. Or I'm not going to go in order, by the way, with some of these questions. Okay, this next question, this one is for you, Nicole. How has your mom's mental state held up with having long-term liver disease and then HCC?
Well, actually, she did not have long-term liver disease. She just was diagnosed with the HCC.
Correct. That was your father, correct? That had liver disease?
It was correct, cirrhosis.
Great. Okay, Laura, this one's for you. Does Will use Tampa General for treatment primarily or Moffitt?
General. It is our hospital of choice. His oncologist is actually an hour and a half away in Brooksville, and he has a consultant in California. So it's kind of spread around the country.
Wow, wow. Okay, George, let's give you this one. What type of clinical trials was Will looking at, and what did Will receive?
So that was a very, very difficult just to get through them all and figure out which one to do. I mean, there are a whole bunch of trials to try to figure out which one to do. He did do a clinical trial that's no longer available with ribosome. I mean, so with riboscience. Um, I don't want to get into all the details about it, but because each person is going to have a very specific to what they should do based upon their biomarkers and genetic. So it becomes, I think, a very focused science to figure out which one it is to do.
Okay. Thank you. And just a reminder, we have a clinical trial tool on Blue Fairy's website, bluefairy.org, BLUEFAERY.org. Laura, back to you, just some clarification. What was the primary hospital? Wendy missed the answer there.
Hospital. The first one he went to with the initial diagnosis was St. Anthony's in St. Petersburg. And then we transferred care to Moffitt, where he was in research there. And then we moved on to Tampa General.
Okay. And I'm seeing some amazing, we will try to get to the chat responses. Thank you so much for the amazing chat responses. I'm going to quickly ask this one, and anybody can answer. Did anyone ever have a histotripsy procedure? And I'm going to put a link to that in the chat if you don't know what that is, that type of procedure. It's not as new as it used to be. Or I'm going to give you the link to put in the chat, actually. Did anybody have a histotripsy procedure? No? Okay. It's not as new as it used to be, but it's not widely available. You really have to be at a major cancer center or an NCI center, and of course, not everybody's eligible for that. This is a great question from one of Blue Fairy's very special people, and this is for anyone. Did any of the survivors, did anyone here have a nurse navigator, and did they use integrative oncology as an adjunct to therapy?
No.
We had
No
a
nurse.
we had a nurse navigator, and
Okay.
yes, but we did not do any adjunct therapy with,
Okay.
yeah.
Okay. George and Laura, did Will or does Will have a nurse navigator of some sort?
No.
No,
There
interesting.
was somebody he's got an HMO, so there was somebody, a nurse that assigned to handling, getting things approved for the various things that he needs to be done, because all has to be approved. So that was very helpful. That was something that Blue Cross did, and that getting to know that person was helpful.
Yeah,
Whatever.
when my sister was diagnosed, they didn't call them nurse navigators. They were case managers. We had case manager and a social worker. And I see, Amy, I see you have a great question. Would you please throw it in the Q&A? Because we love, I'm sure Nicole would love to answer that. This is for anyone. Anonymous, is every malignant tumor found to be very large? How often is a lesion of a smaller size discovered, especially in someone who has MASH? So we can't give medical advice, but George, why don't we throw this one at you because you are a physician. How often is a lesion of a smaller size discovered?
I think it's in the minority, but when those discovered, they have about a 95% chance of cure. You want to discover them early. I'm not an oncologist, so I can't give you all that stuff, but I can say that there's the spectrum, and it depends, I think, on a variety of factors. So both of our stories are that they were discovered late stage 4, but it just gives us all a good reason to figure out whatever we can do to diagnose things sooner, and to know that people who have certain risks, like hepatitis B, might go on to that, so be looking for it. I think those are, and whatever we can do to help prevent it would be a good thing.
I totally agree. And this is someone who wrote in a question who had to leave because it's midnight in India. And it's why do many cases of HCC remain undetected until late stages, despite the availability of screening tools such as ultrasound and AFP testing? I'm going to take that one, and then please feel free anyone to chime in. first of all, most people aren't screened. Even if they have a known liver disease, they're not under surveillance. And then as far as the screening itself, most people aren't screened for liver cancer. So I always say, if you're going for your annual checkup, if you do have insurance, ask for a metabolic panel. It's a check mark. It's covered. It's simple, but it's not common practice. And that metabolic panel will tell your physician, even your primary care physician, if your liver enzymes are elevated, and that could be an indication something is wrong with your liver. But also, the other reason HCC often remains undetected until late stages is because, in simple terms, our livers don't have pain receptors, right? So when we start to feel pain, it's usually caused by something else. And a lot of symptoms, and I think George alluded to this, or Laura did, a lot of symptoms that like acid reflux, right? Acid reflux can be a symptom of liver cancer. Most of the time, it's not. It can be a symptom actually of a lot of different GI cancers, but our livers don't have pain receptors, and also we don't do regular screening. And I see some more questions in the chat, so please put them in the Q&A. Let's see, Nicole, this is for you. Nicole, do you think that your equine therapy would be beneficial to others fighting cancer? And where would they go to find such therapy?
Absolutely. I cannot advocate enough for equine therapy. There's something really special about horses. Horses help with Asperger's, they help with autism, they help with people going through PTSD, mental health, cancer diagnoses, anything. So if you can get involved in a non-for-profit equine therapy organization, I think that's great. I would definitely just get on Google and I would Google equine therapy in your state or your country, and see where that takes you. It should lead you to something. There also is a program, and I do know that it is nationwide. It's called EGALA, EAGALA.com, and they are a great resource for equine therapy.
Okay, or let's make sure we put that in the YouTube description. And we have a great comment here. Additionally, regarding the other question, patients do not have the traditional risk factors, especially young adults or teens, and that affects diagnosis 100%. That is very, very true. And in fact, we're seeing more adult patients that don't have any underlying liver disease whatsoever. They don't have hepatitis B or hepatitis C or fatty liver of any kind. And so you wouldn't even think to screen them for liver cancer. So great point. All right, Katie, thank you so much. This is for anyone. When there are other when there are other medical issues, are clinical trials limited?
I'll take that one. Yeah, each clinical trial has an inclusion and exclusion criteria. It kind of becomes overwhelming for figuring which one's which. I mean, you send the medical records in, and then they'll give you feedback. One of the difficulties is being able to know if you're going to a certain medical system, usually they will put you in the clinical trials in that medical system. Trying to get into a clinical trial outside that medical system is a challenge, and there's a lot of things to go through, and it usually doesn't happen.
Yeah, that's a great point. Yeah, I always tell patients, again, we have a great clinical trial tool on Blue Faery's website. And what I love about the tool is it defaults to HCC, but it asks you questions. How far are you willing to travel? It asks you about these underlying liver diseases, and you'll see it starts at, let's say 300 trials, and then based on your responses, it narrows it down to give you trials that are actually viable for you. And I also tell patients, if you're looking at clinical trials on clinicaltrials.gov, which, by the way, our tool pulls all from clinicaltrials.gov, skip the inclusion criteria and go to the exclusion criteria, because that list seems to be longer. And then you don't want to get your hopes up that you might be able to be in a trial when you get to that exclusion criteria that tells you, nope, they're not going to take you. So, and that's very, very unfortunate. And it's something I've actually spoken to the FDA about inclusion, exclusion criteria. Robin, I'm going to read your question. I'm going to read your statement. I'm not sure if there's a question. If you're still with us, please let us know if you have a question. Um, I have HCC with thrombus clot in the hepatic vein system. The tumor is 2 by 2. I had radiation 1 time and immunotherapy for 28 days. So far, I don't qualify for clinical trials due to the clot. So I'm really sorry to hear that, Robin. I don't know if you have a specific question, but you're more than welcome to reach out again to our community, to Blue Faery, and see what we can do to help you navigate that. Let's see. We have another great chat comment. Or I think I'm going to have you read these chat comments at the end that are not questions, but just great comments. This is the last question, and I'm going to let the panelist answer, and then I will answer. Wendy, thank you so much for this question. It's a very, very brave question. Has anyone been cured at this time?
We were cured, and then unfortunately it came back and turned into metastatic hepatocellular carcinoma.
Yeah, yeah. Anybody else?
Well, if Bill is not cured and he's had a very good response, but now it's come back, which is very common when you get a new mutation, and unfortunately it's spreading now. So we're back in the fight again. So no cure in sight, which really makes it emotionally difficult when you deal with this.
Yeah, and I will say, over the 20 years I've been doing this work, I can count on maybe 2 hands the survivors. Maybe 2 hands. I'd have to really think about it. I do know a very recent survivor who underwent 2 to 2.5 years of immunotherapy. Had an incredible response. Only about 20% of people respond to immunotherapy, and she is now considered a survivor. And her oncologist was so shocked that he said, "We need to move you into survivorship, but I don't even know what that looks like for HCC." Um, and um, and so it's a really tough cancer. Again, I mentioned at the top, it's the third most common cause of cancer deaths worldwide. And to quote one of my favorite physicians, it's a really tough cancer because not for everyone, but for most people, it is a disease within a disease. So you're fighting whatever the underlying liver disease is, but you're also fighting the cancer. And we've had many, many patients where they were responding to treatment, so the tumors were shrinking. So on paper they were responding to treatment, but then their liver was going into failure, and vice versa. Dealing with the liver disease, and yet the cancer is still growing. So it's a much more complex cancer than most other cancers. I know I'm biased, but I feel like that's fair to say. I don't know. Would our panelists agree with that? That it's a more complex cancer?
Yes, the other thing I'd say is what you want to do is improve the quality of life along the way with people who have a very difficult disease that you don't know how long they're going to live. And we've heard about Y90, we've heard about TACE, and we've done the TACE, and most things really improve the quality of life and make a difference. So every bit of day that you get that's good is a gift.
I agree. I agree. Aura, would you launch the poll as we wrap up? And then would you also please read the last 2 comments we here have in the chat?
Of course.
Thank you. And thank you again to
Okay.
our amazing panelists. Thank you so much. Thank you for attending live. If you're watching this, the replay on YouTube, again, we will have links in the description below so you can reach out to Blue Faery. So this is the poll. We want to know, after today's webinar, what's one step you feel encouraged to take next. And hopefully you can see this again. Zoom changes things every other day, so sometimes we don't know. If you can't see the poll, please let us know. We'll just talk about it. In the meantime, Aura, would you mind reading those last two chat messages that really add some value here?
Yes, of course. I want to start off with we had someone join us all the way from India, and their comment is this session has been truly enlightening, deeply
Aw,
moving, supportive, and motivating. It beautifully includes the profound importance of community and the strength we find in standing together. But sadly, it was almost midnight over there, so he had to jump off. Um, we have Kareen tackling the volumes of clinical trials and their acceptability rules is sometimes all encompassing. So I feel it is critical to have the most expert position on the team who are truly active in the clinical trial community. Uh, where you're treated is the most important thing.
agree.
Uh,
Yes,
we
hard
also
agree.
have Scotty. As far as being screened, it's becoming more common to hear gastroenterologists doing EUS with FNA procedures to make samples of liver tissue to be submitted to pathology, especially if masses are found from previous imaging in and this is done in larger hospitals throughout the United States. And we also have Kimberly. Thank you for such good information today.
You're welcome. Can you guys let us know in the chat, are you able to see the poll? Because this is good information for us. We know you couldn't see the quiz. Um,
We have
let's see.
about 7 people that answered the poll so far. We'd love to hear what all of you think, so make sure you answer the poll.
Oh, okay. Can you share those results for us?
Sure.
Uh, great. Okay. So 43% of you are going to talk with your loved one about how I can better support them. 57% you're going to focus on taking care of my own physical and mental well-being. 57% seek out additional resources or support communities. 43% have a conversation with family or caregivers about next steps. And that's a conversation I wish I had had with my sister about. I just couldn't face the fact she was dying, and I wish we had had an honest conversation about it. I just want to address one more person in the chat before we wrap up. I have stage 2 bile liver cancer, and this has encouraged me to get a second opinion and look at trials, good info. I can't see your name, perhaps Aura can. RK.
Robin. That was
Robin.
Robin. Mhm.
Robin, I strongly recommend because bile duct cancer is different than HCC. It's treated differently. It's very rare. I strongly recommend the cholangiocarcinoma Foundation. They focus, just like we focus specifically on HCC, they focus specifically on bile duct cancer, also known as cholangiocarcinoma. So strongly, strongly. And yes, please get a second opinion. Okay, so first of all, can we get some reactions to our fabulous panelists, like amazing panelists? Thank you for sharing your vulnerability. All of you have made me tear up at different times during this. I'm probably going to cry when we're done. So thank you so much. I also want to acknowledge our 2026 sponsors. They have no control over the content, but they do support these endeavors. So thank you very much to Azi and Merck. And then I'm going to turn it over to my lovely co-host, Blue Fairies Program Manager Aura, to wrap us up with the last two things. And I will put them in the chat as you talk about them.
Thanks, Andrea. So I want to encourage everyone if you need support and you're looking for someone to talk to, or you just want to share some of your story, you can by joining our Blue Fairy community. Again, that is a HIPAA compliant community. And Nicole, our lovely panelist, is also a moderator on there. So please
And
make sure to
actually,
join her.
Aura, you gotta throw it in the chat. I can't.
Oh, okay. So I will throw it in the chat for you
Sorry,
guys.
you have to talk and throw in the chat at the same time. Sorry, keep going.
Z- Zoom is wonky that way when they do their updates. Alrighty, so I'm throwing it in the chat for everyone to see. And if you can or and are willing to, we also encourage you to donate to Blue Fairy and our program so we can continue doing this amazing work and sharing it with patients, caregivers, and families facing HCC.
Thank you, George, Nicole, Laura, Vicky, in no particular order. It's just how you're appearing on my screen right now. Again, I want to thank you for your sharing your story and for being so vulnerable. And it really affects the whole family. It really does. And Vicky, you and I have met in person, and I am praying for you and you and Nicole. And Nicole, we're so grateful to have you as a volunteer. And George and Laura, I'm praying for you and for Will. And as a parent, it's very tough. So I thank you guys. I hope you have a wonderful weekend. And Aura, I'll let you have the final words.
Yes, thank you so much to all of our panelists. I really appreciate you guys and hearing your stories and meeting with me previously to this to get everything together. It means a lot to me and I know to everyone that has joined today's panel and that will be watching the replay. So thank you so much for your time.
Thank you.
You.
Thank you, everyone.
Thank you.